Now, dangerous delivery. We've uncovered a shocking stat. According to the Centers for Disease Control, the rate of death for pregnant women in the U.S. is more than double what it was 30 years ago. We checked, and that holds true here in Rhode Island as well.
So what's behind the increase, and what can expectant mothers do to protect themselves and their babies? Kelly Sullivan is here now with what she's learned in a story you'll see only on Eyewitness News.
Mike and Shannon, according to the CDC, the United States is one of 8 countries, along with Afghanistan and Sudan, where the rate of women dying as a result of childbirth is going up instead of down. In this time of evolving technology and improving health care, we went to a local doctor to find out why.
And she's out.
Kara Sanchez went through a lot of emotions during her pregnancy with little Abigail. Excitement, nervousness.
Never in a million years did I think she was going to have to come a month early.
But health complications weren't high on that list until one forced her into labor a month early, putting her and her baby at risk. Both are doing just fine, but startling numbers released by the CDC show Kara was almost part of a disturbing trend. More expecting mothers are dying in the U.S., either during pregnancy or labor. In 1987, there were 7.2 deaths of mothers per 100,000 live births in the U.S. In 2011, that number more than doubled to 17.8 deaths per 100,000 births. We checked with the Rhode Island Department of Health and found over the last 4 years, our rate was well above the national average at just over 28 deaths per 100,000 births. Keep in mind, Rhode Island's small size means even one death can change the numbers drastically. Is it shocking to hear the numbers are on the rise here in the U.S. when you think a country like the United States of America, the numbers should continue to go down?
I think it is surprising and somewhat shocking.
Dr. Tabassum Feroz is an obstetric medicine specialist. She tells me there are many factors behind the increase. One, better data collection. She says better record keeping in the past decade means fewer maternal deaths go unreported.
It may not be as dramatic as what we see because of this accountability for data collection, but it is going up.
2, more women are waiting until later in life to give birth, and with older age comes the risk of more pre-existing health conditions. 3rd, obesity.
Obesity is related to a lot of complications like high blood pressure, diabetes. So if we can plan for pregnancy or provide preconception care, that very much has been shown to reduce risk.
Dr. Feroz says women aren't dying of the same pregnancy complications they were years ago. Her research links the current trend of maternal deaths to pre-existing medical conditions. Many of these conditions can be diagnosed early on with proper screening.
So these are called indirect causes of death, and I think that's the thing that we are seeing now in research that we need to really pay attention to and work on.
Dr. Feroz also says lack of equal access to affordable health care, especially for minority and low-income women, is a key factor in this increase. Now, you can see the complete stats we gathered on maternal deaths in Rhode Island right now on our website, WPRI.com. I'm Kelly Sullivan, Eyewitness News.